Hello, everybody. Thank you for joining us. Appreciate you being here. We have some data points to go over, a couple updates on important topics, and then we'll take some questions. We have seen what this virus is doing to our communities who are vulnerable, and we have lost more neighbors. We have had 3 neighbors leave us over the last 24 hours. They were all males. One was a Caucasian in his 90s, one was an African American in his 80s, and one was an African American in his 60s. We now lost 40 people due to COVID-19, 29 Caucasian, 7 African American, and 4 of another race, 22 females and 18 males. I want to take this opportunity to think about their families, grieve with them, and certainly our prayers go out to not just those who we've lost related to COVID-19, but everybody in our community that we've lost during this process, where their families have certainly not been able to mourn and heal the way that they normally would be able to. Related to cases, we now have 1,115 cases. That is 1115. That's up from 1,088 yesterday, so 27 new cases. We'll get into the breakout of those shortly here. Hospitalizations. Yesterday I warned everybody that those numbers were too high, and some aggressive headlines were made after that, so hopefully we'll get aggressive headlines saying that our hospitalizations are down to 47 today. And this is essentially about 10% of our active cases. So we have 47 individuals in the hospital. We have 13 folks who are critical. This is up 2 from yesterday. That's representing 3% of our active cases. Out of those who are in the hospital, we have 24 Caucasian, 12 African Americans, 7 of another race, and 4 individuals who have declined to share their race with us. Looking at our hospitals, we have 137 people who have been released from the hospitals. This is up 11 from yesterday. Part of that is people went in because you had certain facilities dropping them off just because they tested positive to COVID. And part of that, so many of those were representative in that 11 people who've been discharged. Also, there were some people who got better as well. So we're very thankful for that. Overall, we've had 623 people who have recovered. That is up 4 from yesterday. A reminder on recoveries. A recovery, if you are not a senior citizen, is you've had 7 days of really symptom-free COVID-19, and you've had 3 days straight with no temperature. During this process, since we started our proactive testing, the recovery guidelines and guidance has changed related to seniors. So seniors, no matter what, have to show recovery for a period of 14 days. So our active cases are now going to stay flat, if not increasing each day, because many of these folks are seniors. They're gonna be there at minimum 2 weeks now, whereas before you had many people coming off in 1 week. This is smart. It's being very conservative with our seniors. We know that they're very vulnerable to this illness, in this disease. When we look at our active cases, 452. Out of the active cases, essentially 2/3 are now related to affiliations of senior buildings, nursing homes, assisted living facilities, independent living facilities. So, and then contacts, household contacts. So we look at that total number out of the 452. We have 302 essential folks who are active right now that are from affiliated properties related to seniors and or household contacts. So then you essentially have about 150 people that are community spread cases. Our household contact case is at 152. That's 5 more than yesterday. So out of our 27 new cases, 5 of them are household contacts. And 14 of our new cases are related to senior living facilities. So when you break it down, we have 27 new cases. 19 are from contacts or affiliations. 8 are from community spread. So if you see this chart here, green is community spread. The purple or the blue is related to affiliated cases and or contacts. So certainly a better day for the community spread than the day before, which is better than the previous days. So that is a little bit of good news. We now have 1,200 people still in quarantine. When we look at who all of our positive cases have been, 640 females, 475 males, 35 under the age of 19, 190 in their 20s, 139 in their 30s, 147 in their 40s, 185 in their 50s, 165 in their 60s, 115 in their 70s, 92 in their 80s, and 47 in their 90s. When we break down percentage by age, 20% are under 30, 33% are under 40, 46% are under 50, 62% are under 60, and 38% are over 60. When we look at geography, City of Syracuse, 564 total cases, 266 recoveries. Clay, 97 total cases, 72 recoveries. Onondaga, 81 total cases, 28 recoveries. Manlius, 59 cases, 39 recoveries. DeWitt, 55 cases, 33 recoveries. Salina, 45 total cases, 33 recoveries. Cicero, 42 total cases, 29 recoveries. Camillus, 39 total cases, 30 recoveries. Gaddis, 37 total cases, 21 recoveries. Lysander, 29 total cases, 18 recoveries. Pompey, 22 total cases, 20 recoveries. Skaneateles, 15 cases, 13 recoveries. Van Buren, 8 total cases and 3 recoveries. Lafayette, 4 cases, 2 recoveries. Atisco, 5 cases, 4 recoveries. Marcellus, 5 cases and 4 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. And Tully, 2 cases and 2 recoveries. Testing. The only numbers not in here are New York State negative tests. But we haven't been receiving those consistently throughout this process, so it won't really skew our data too much. But our overall percentage of positive per test is a little bit lower if you would factor in these numbers. But right now, we've done 14,101 tests in Onondaga County. 13,459 tests have been returned. 205 have been returned since yesterday. There have been 1,115 positive tests and 12,344 negative tests. We have 642 pending tests. Since yesterday's reporting, we did 515 tests. If you look at what our county needs as far as restart numbers, we still don't have clarification on if we're looking backwards from the 15th for restart testing or it's moving forward. But 515 a day out of us gets us over the number regardless. That's a lot of testing. Positives, about 8.2% of our tests have been positive. If you brought in negatives into this data that we don't have yet, that would drive that number down a little bit, but pretty consistent when you look at Onondaga County. When you look at Central New York as a region, a little bit closer to 7%, but really doing quite well compared to other parts of the state. Certainly gaps in the investigation. We talked about this. Let me give you a couple gaps in the investigation. This is a scenario where we had a individual in these businesses that was COVID-19 positive. Let me see if it says anything about if they're wearing masks or not. This is fresh off the press. It doesn't tell me, so let's assume the worst. Let's assume they were not wearing a mask. Rite Aid, 519 Butternut Street in Syracuse. If you were there from the hours of Monday, April 27th, 7 a.m. to 4 p.m., or Tuesday, April 28th, 11 a.m. to 7 p.m., please be cognizant of your symptoms. Someone was working at that facility that has tested positive for COVID-19. The Dollar Tree on 3130 Erie Boulevard East in DeWitt. We had a shopper who shopped during this hour on this day. Tuesday, April 28th from 11 to noon. So if you are at the Dollar Tree on Erie Boulevard, 3130 Erie Boulevard East in DeWitt, and you were there between 11 and 12, there was someone else in the store that is tested positive with COVID-19. So please be cognizant of your symptoms. Target, this looks like an employee, 340 Town Drive in Fayetteville, Tuesday, April 28th, from noon to 4 p.m. There was an employee working those hours that is tested positive for COVID-19. So look, at the reality is we've had community spread. We've stabilized it, but it's still here, and there's still the potential to get it. So we need to be smart and protect ourselves when we're out in public and our families. But certainly we should be monitoring our health every day, taking our temperatures, being very cognizant of what your symptoms are, so that in the event you are feeling a little bit not like yourself, you contact your doctor, and then if they feel it necessary for you to get a test, we get you tested.
The press release says, yes, they were wearing a mask.
They were wearing a mask. Excellent. Thank you, Andrew. So we assumed the worst. Now we've gotten the news of the best, that they were wearing a mask in the stores. Related to physical distancing, these masks, I'm going to just show everybody how you're supposed to wear one. Many people are not wearing them the way they are supposed to. You put it over your nose, in your mouth, and then you go like this. Okay? This protects you and people around you from mucus and or saliva getting out. We've received many complaints from employees at a business that will be wearing a mask, and it will either be down on their neck or not covering their nose. Certainly that kind of defeats the purpose overall. So please, many stores don't allow you in their store without a mask. If you need a mask, please reach out to us. We have many of these masks, and we will get you one because we want to protect you and your family from this virus. Certainly, as we live with this virus moving forward, when we have a restart, we're going to need to continue to be cognizant, be smart. We know the virus has a difficult time transmitting from individual to individual when we're 6 feet apart. We know it's even harder when we're wearing a mask and being 6 feet apart. We've done a nice job stabilizing this and really putting our county and our region in a position for success related to a restart, to start to get people back to work, start to resume the types of activities that we want to do moving forward. We need to continue to be diligent. So I want to thank everybody for the work they've done, but more importantly, the work they will do moving forward. Related to a restart, we continue to move towards that process, more information. Certainly, we're appreciative of some of the loosening of regs on existing businesses. We put out an interpretation related to auto dealers, showrooms. I've been saying this for a long period of time. Showrooms by appointment only, where people are wearing masks and you wipe down the car after. Showrooms are very large, very easy to physical distance. We're happy that we worked with the state of New York to be able to clarify that regulation. This is an important way to get some people back to work. Some people don't necessarily buy a car online. Many have, but some people want to physically see it. Understandable. So this is important for our economy as we start to get going. We have to find balance with our economic interests and our public health. We'll continue to find that balance, but part of that is moving forward, loosening up regulations that make sense. And auto sales is our #1 driver of sales tax for Onondaga County, also the region, and certainly the state. So the state needs money, we need money. This is a way you can loosen up some regulation in a safe way and generate some more revenue because we need to pay our health department. So we can take other restart questions. I'm sure you'll have some, but a couple numbers related to services that are important that we talk about every day. Our Upstate Triage Hotline, a line that you call to get screened for COVID-19 symptoms and then get tested at the Syracuse Community Health Center, 315-464-3979. Our seniors, our healthcare workers, and adult nutrition hotline, 315-218-1987. Please call this number if you need help with a meal. For a reason, you can't get to the grocery store, you have an emergency, if you're a essential worker, a healthcare worker, or a senior, will help fill that gap. If you need a mask, you can call that number as well. Our continuity of care planning, which has helped us keep our essential business employees working when they've had gaps in child care in this process. That number is 315-446-1220 with our partner, Child Care Solutions. We have extended this program free of charge to all of our essential business employees through the month of May. So please take advantage of that. And again, mental health, certainly something that is a very serious health-related issue. And we have professionals at 211. Literally, you call 211, and they can be there to answer any questions you have, help you with strategies, help make referrals, so that people really can get help when they need help. We've had over 13,000 phone calls to this line since March 17th, which really shows you how this pandemic is impacting us in different ways. We know about the physical threat, we know about the economic ruin, but also the mental health impact that it's had is something that certainly we're cognizant of and something we're going to have to address as a community on an ongoing basis. Questions?
Kinds of businesses that you're aware of that might loosen up and start operating before the 16th, like car dealerships have? The example somebody asked me about today was like mobile dog groomers. Why couldn't they operate?
Yeah, so we're getting a lot of those, and so we have. My understanding is your vet for your animal is essentially open for visits, but grooming is a different category. I believe, I'm not 100% sure of the reasoning why they aren't allowed right now. I believe it actually has to do with the fact that many animals can get COVID, but we have gotten the same correspondence. We have gotten actually from many dog groomers and pet groomers ways they can operate safely, and we are sharing that with the state of New York.
Do you think there will be other businesses that can start?
Yeah, I think I'm cautious to say other new businesses that are offline. Car sales was allowed. There was either an interpretation gap into the existing rules or an agreement that the showroom by appointment only is a controlled way to loosen up a regulation. So is there the potential to loosen up more regulations on existing businesses that are deemed essential today? Where we see it and we think it makes sense, we advocate for it. So we've been doing that this whole process. We'll continue to do that. And then if our partners in the state agree, then we will give out guidance to those businesses so that they know that they can then operate in this way under the new guidance or the new regulations.
We got some new data today on nursing home deaths, which seemed a little startling. It went from 5 in our county to 17. Are you confident that we're getting accurate numbers on that now? Do you guys track nursing home deaths from the county health department?
So we don't, because that's not our lane. We've been, but we know that those numbers are including in our totals every day, and we understand that we can put 2 and 2 together, but we're making a little bit of an assumption, and we're waiting on the state to clarify that. The reality is, and we've talked about this, is that this virus has made its way into buildings that are homes to our community's most vulnerable. And it is spread, and we know that because we've been talking about that. That's what triggered us going out and finding all the asymptomatics the way we have and pushing our partners in the state to do the same. And now we're finding asymptomatics or light symptom individuals. But when you look at the age demographics, these are very scary numbers for our neighbors in their 90s and in their 80s who have become COVID positive, especially if they have symptoms. So again, while we'll see in this whole process, we see positive things as we're learning to live with the virus, as we're learning to move into this next phase of this fight, try to get our lives back. The reality is we have sick people to begin with now getting this virus, and I have a lot of fear about more bad outcomes in the future, as we've done a lot to prevent and preserve and save lives with our proactive testing, but the reality is in some of these facilities, COVID was already there, and it's a killer if you have underlying medical conditions, or if you're a senior, you have a hard time with this. We know this.
Are the 3 latest deaths related to nursing homes?
I don't know that. I'm not going to make assumptions on death until I know that publicly in my head. When I see something and I look at some of the demographics, do I make assumptions in my head? Yes, but I'm not going to comment on it publicly.
You don't have that information right now to comment on?
Nope.
Okay.
Have you broken out the numbers on the proactive testing that the county has done in assisted living and senior facilities to know how many of those, what percentage of those are positive, what percentage are asymptomatic?
Yeah, we're trying to go through that now. Right now, we've built up this robust testing regimen to make sure that no matter what the state's interpretation on restart is, we qualify. And so it's a little bit, it's hard. We are starting to know the asymptomatics. I know that I believe our proactive testing number is probably over 2,000 at this point. We just had 515 yesterday, and I know 75 or 80% of those at least were related to proactive tests. So what you're seeing is, and again, I'm anticipating with proactive tests, we'll see a downward trend as far as positive rates compared to our 8%. And the reason why is because we started our proactive testing in areas where we knew we had positive cases. So now we're going into some buildings that have no known positive cases. That doesn't mean it hasn't been there, but maybe it hasn't. So we'll get a slew of tests into a building that doesn't have positives. And, so that will determine, that will skew some of that data over the long period of time. So as we're doing 13,000 tests a month moving forward, at some point we're going to start to see our rate of infection go down because we're just testing pockets of people that show no symptoms. There's been no cases, and we anticipate that. But we're very interested in trying to understand how many. I think last week at one point we knew we had found about 50 asymptomatic individuals through our testing. Has that gone up? Probably. We've had a lot of tests returned in that. But those are numbers that once we have, we'll certainly share. Because that tells a story even more into our active cases about how many of these people are actually not sick that could have potentially gotten other people sick. But because they're not sick, the recovery, well, now the rules have changed, but old rules, the recovery would have been quicker.
Have you resolved the problem of asymptomatic people being sent to the hospital by nursing homes?
Some of them got sent back to other facilities. That's part of the drop we had in hospitalizations. I don't know if every person found a new facility to go to or not, but certainly part of why we had a drop in hospitalizations was because we had some more people come in that were sick, and we had some that weren't really sick that never should have been there go home. So I think the number's at 47 today. So, depending on that's probably going to be right around where this thing's going to go, because you'll have some people recovering, and you'll have some people who are vulnerable, getting sick and getting into the hospital.
Is there a way to resolve that from happening moving forward?
I think there's going to be communication, Andrew. I believe there's legal rights that they can actually do what they did, which makes no sense. But again, we're not the regulatory arm on that. But certainly we're talking to all these nursing homes. I'm having a call with all the nursing homes. I'm having communication with all the assisted living facilities. We have expectations as we're going through this fight together that we're going to partner every step of the way. If they're going to change the way that they do business, they need to let us know, so we're not getting a call from a hospital saying X nursing home just dropped off 8 people that aren't sick, and that just tested positive and they have light symptoms or no symptoms. We don't need those people in the hospital. We need those people isolated under a quarantine situation similar to a community spread case.
How is the community doing on social distancing? I mean, of course, we had a couple nice days over the past couple of days. Are people falling back into old patterns, or are we doing better?
Yeah, I think so. It's interesting. I think over the weekend we'll know how we did with the increased activity over this past weekend. We'll probably see those. If we see an uptick in testing on Friday and Saturday, we'll probably see the results Sunday. So if you see an uptick of testing related to symptoms, not our proactive efforts, that will tell you that by being together more, the infection spread more. And so I think a couple things that there's early trends in other states that have a little bit sunnier weather than us and a little bit warmer weather than us that might suggest that this virus doesn't do as well in that type of weather. So maybe as we're getting back together and giving more opportunities to spread, the virus is weakening a little bit. We don't know enough about that. But overall, a lot of people were out enjoying the community this past weekend. There's nothing like summer in Central New York and fall in Central New York. So we need, for our mental health, we need to be able to do that. We just need to be more cognizant of when we are out, making sure that we're not putting ourselves in situations of large gatherings. Nobody knows, even if they're your friend, you don't know everybody they've been interacting with. You don't know who they've been at work with. You don't know what interactions they had when they went shopping. That's not to suggest that they have it, but what we don't know, we don't know. What do we know? 6 feet keeps you safe. Masks helps even more.
Can you elaborate a little bit on the businesses or the type of business where people were reported not wearing their mask correctly?
Yeah, look, there's a lot of retail that I've seen myself when I've gone into some of these stores, and certainly we get emails consistently about anytime someone goes to a store and sees somebody walk in without a mask. Now, some people have respiratory problems, so they don't need to wear a mask if they have bad asthma or whatnot. I believe that was part of the governor's order. But, again, there's many that could wear a mask. So if the mask is the issue, you can't get your hands on the mask, reach out to us, email me, we'll get you a mask. But if you have one, please wear it.
You mentioned Walmart being a place that isn't enforcing it for every person, whereas Wegmans is. Walmart has had a track record of public exposure in this county. I know Walmarts elsewhere have had some rampant spread of coronavirus. Would you specifically ask Walmart to start enforcing this?
We've been reaching out to Walmart and explaining our concerns. And the concerns, it's ironic that the same store that has a testing site at it has people where we're getting positives, right? So hopefully that's irony. But these stores have the ability to make that call. The government should not make that call for these stores. And so it's not good business if I have to sit here and talk about your store 2 or 3 times a week because of potential tracing that we couldn't fill all the gaps, right? So that's just not good for your store. So let's just do everything we can to mitigate that risk. It's all about risk mitigation for us individually, for the businesses. So we just ask for continued collaboration.
You've made that request?
Yeah. Yep.
Their response?
I don't know how the response is yet. We'll see. We'll see. Sometimes we talk about these things and we get good responses.
Ryan, you've talked a lot about the increase in affiliated cases. I wonder, as you look at the community spread on your green chart there, you wouldn't say that's going down. How concerned are you about community spread as we head toward a reopening of the economy?
Yeah, so if we look at 7-day averages, running averages, so the 7-day average is our best the previous week. Our new 7-day average started on Saturday. So what do we had? 22, 21, 21, 22, 18, and 8. So certainly 21 and 22 is manageable. the numbers don't scare us. It's going in a little bit of a different trend. 18 and 8 are better. If we can have a running average in the teens, that's pretty good when you go to ramp up for phase 1. But we're prepared. These aren't crazy numbers with community spread, and we believe that we've, with our other testing, we've gotten through our hot spots, and so that we don't anticipate the level of intensity with some of these independent living centers and other areas we'll be testing that we had through affiliateds and assisted livings and nursing homes. So we think that intensity of positives is going to loosen up a little bit. But it's manageable, Tim. We stabilized the community spread in the community. At one point, it looked like we could really get this thing down to next to nothing. But I don't know if that's realistic. I think if you look at, we've had this, and we've only been able to compare data to ourselves really through this process. But we talked about this with hospitalization rates yesterday a little bit. Our worst day with numbers in hospitals never even stressed our capacity. It wasn't even close. So for us to hold ourselves to a good number means you need to be great all the time. And when you look at our rate of infection in our community, with a community our size, we're the best. And so we're holding ourselves to be the best and have to maintain the best. So to compare it against ourselves, I guess if you're looking at 11 one week and 16 or 17 the next week, we'd rather be on the other side of 11, but our infrastructure can handle this. When it becomes a problem is when you're getting the random spreads where you're getting 70, 80, 90, 100 a day, and your infrastructure is really getting tested, and you're implementing all those new tracers you have, and they're running around. That will be more challenging. I don't think we'll get there, hopefully, knock on wood. But certainly we anticipate whatever we stop going into restart, whatever that 7-day average is, we anticipate that for next week will be higher. The question is how much higher?
Do you have any plans to go and retest some of those senior living facilities?
Yeah, I think you're going to have to retest employees. And that's going to have to be, we'll have to figure out what that protocol is, but that's going to have to be an ongoing issue with your any employees that have direct exposure to COVID. I think will be part of our monthly testing strategy. And then because certainly if you have any exposure, you can test negative one day and be positive 2 days, 3 days, 4 days later if you didn't have the proper PPE.
The governor had to sign off on your allowing of auto dealerships for the appointment?
We communicated with the state multiple times about clarification on that, and once we got the interpretation that we were looking for, we put out the guidance. So that's how that process worked.
How excited are you that car dealerships can reopen?
Yeah, so I want to make sure the public understands you can't just show up at a showroom. So don't do that. You won't be allowed. This is a controlled scenario where if you want to call your favorite car dealer and set up an appointment, then you go. But if there are dealers that are just letting anyone in the showrooms, we're going to enforce this and we're going to fine because we need to lead by example in this process. So we've worked with our auto dealers, but I think this is very important. So just like we felt really good about elective surgeries, this is going to open up more sales that are sitting there that just people aren't. Some people can buy and shop online. Some people got to see and physically look at the product. A car is a pretty big purchase, so a lot of people like to see it. So there's people that are ready to buy cars right now that we just can't capture that because they haven't been able to go and see it. So now we're going to capture those sales. It's important to us. It's important for the people that need new cars. It's important for the employees that get their paychecks off of that. And it's important to the state, too, because the state's going to get 4% on every in sales tax on every one of those sales as well.
Are you seeing infection data from nursing homes? You've said a couple times that you're still worried about fatalities going forward. I guess for all the people out there who have loved ones in nursing homes, what are you looking at?
Look at majority out of these numbers are related to senior facilities. So we've been doing testing in assisted living facilities, and the state's been testing nursing homes. So COVID has a pretty proven track record that it is nasty on folks who have pre-existing conditions or underlying medical conditions, and our seniors, specifically our elderly. So I'm really concerned about that, and I'm not going to sugarcoat that. It's a concern. That's why we did what we did. Our data would look really, really good right now if we weren't doing proactive testing. Our active cases would be in the 100s. You know, we might be getting some notoriety for that, but we would be derelicting our responsibility to public health by not trying to find all the risk in these facilities, because we know the virus got there and is spread. So that's what we've been doing. The actions of all of our partners will save lives, but I am very concerned that we will lose more lives from these facilities because COVID spread through them.
Did those numbers surprise you when the state released that data?
I knew it was, no. I announce every day if there's underlying medical conditions or in the ages, right? And so I think when you look at it, you look at folks who have those types of severe medical conditions, where do they live, right? You look at some of the ages, where do folks in some of these age brackets live. They need help to live. So I think it didn't surprise me, but it's painful. It's painful to think about what's happening to these folks and their families. Other questions? Okay. I want a couple thank yous. One, I want to thank 12 county legislators that supported the STEAM school legislation today. Strategic initiative that will help us get into economic recovery and prepare our young people for the workforce and the job opportunities of tomorrow. I can't think of a better project for our region for economic recovery than our countywide STEAM school initiative. So we have done our job. Chairman Knapp, thank you. And certainly all the other county legislators, Leader Irvin, Legislator Holmquist, and all of our other legislators who supported it. I want to thank them. The other 5, we got a lot of making up to do. But also, I want to give a big appreciation to it's Teacher Appreciation Week. We talked about our teachers, how hard they're working to put together continuity of learning for everybody. Now the buildings are closed for the rest of the year. They're still going to be working very, very hard. Please make sure to call, text, Zoom, FaceTime a teacher and say thank you. And we're very proud of the work that they're doing, helping keep our young people engaged. So saying that, again, I want to just thank everybody. And we're getting through this every step of the way. And please be safe.